When?
This is a seated hangover stretch. This is the easiest and most comprehensively helpful thing you can do for a bad lower back or for a sore lower back. You sit out on the edge of a chair or a ledge. Your thighs should be parallel to the floor. Your knees should be a little bit wider than your shoulders so your shoulders can pass through. If you are in pain, support with your hands when you start. As you go down farther, you can support with your elbows. And if you can get down farther but you can't reach the ground, a stack of books will be very helpful to give your hands some weight to carry so you can do the stretch without hurting yourself. However, I'm not in any pain, so I'm going to show you how it goes straight out. You sit up nice and tall. When I go forward, I want my weight to stay in my butt, so I can't be so far out that when I come out, my thighs and my feet take all the weight. I keep it in my butt, but I'm as forward as I can with the weight in my butt. Nice deep breath. Start with your head and roll down from your head. Squeeze your belly as you exhale and roll the body down. And once again, if you're supporting, that's fine, but if you don't need to, bring your hands on down. Hang all the way down. Forget the world. Don't try to stretch. Just breathe deeply from your lower back all the way up into your shoulder blades, exhaling shoulders all the way down through the lower back. The more you relax, the more you will get out of this. If you try to stretch, it will not do you as well. There's a natural rise and drop to the body as you inhale and exhale. Don't try to abrogate it. Let it do what it does. After about 1 minute of this, you will take a nice deep breath. And as you exhale, squeeze your belly and roll your body up, starting at the base of the spine, coming up one vertebra at a time until you finish sitting up nice and tall. Now that's the first part of the exercise. That's down the middle. There are two more. You take one leg, put it right in front of the shoulder and the hip, the other ankle above the bump of the ankle. Don't bend your foot out of inside. Put it over the bump of the ankle. And once again, you reach out, hang over, and breathe for 1 minute. That's going to get you in the hips. If the center one may make your back feel fine, but believe me, your hips have a lot to do with your back, so do this part too. You got 1 minute right here, rolling down, hanging, breathing, coming up. Then the knee comes inside, lines up with the hip, the ankle goes across. You go over 1 minute this side, exhale and roll up. 1 minute the other side, exhale and roll up. And thank you.